Good morning. So the first thing I want to get across is pre-treatment evaluation. You can call it lesion assessment. You can call it making sure you don't mess up majorly, because that is what you will do if you don't do this well. It is not just endoscopic imaging, but it is, of course, also staging. It is cross-sectional imaging. It is EUS. It is MRI. But actually, you want to focus mainly on endoscopic imaging, of course, because that should be the focus of this course. But please don't forget, and when I get trainees that come here to start with, they are blinkered to the patient, and that is often a very, very bad thing for the patient. I often find as well, and naming no names, but that the colleagues that never had a structured training in this often ignore the things around the resection. So often the things that fail in people who are not having a structured training in tissue resection, but who are having, maybe they saw some, they got into it, is that the patient at the center of it comes to the doctor, they get the thing cut out, and that's what they get. And then they go to somebody else who doesn't really understand the pathway, or there is no pathway. And a pathway for these patients, upper GI patients especially, because these are often more lesions with more malignant potential than the colonic lesions, to be honest. Okay, there is some colonic lesions, the rectal particularly, where there is that problem, but the upper GI lesions are often more, let's call it hardcore.